Hi there, everybody, and welcome to our series for the World Federation of Music Therapy, where we're talking to researchers from all around the world, specialists in music therapy. And today we're speaking to Dr. Ania Bukowska, who is at the University of Physical Education in Kraków in Poland. It's very exciting to have you here, Ania. So let's begin by talking about your research. And because I've met you at many international conferences and heard about your work, I know how interesting it is. But could you take us right back to the beginning and tell us about what motivated you to do your PhD?
Hello, everyone. I'm extremely excited to be here and talk to you and to be able to share my experience and knowledge about research and plus, I'm very excited to speak in sort of behalf of my colleagues in Poland and music therapy colleagues. How it started in my case was quite simple, in my opinion, because I became a physiotherapist and music therapist, and I started my clinical work. And I was really looking for the opportunity to be music therapist and physiotherapist in the same time. And in the moment when I started to use music in the neurology population I work with, I observed enormous changes in the physical behavior of my clients. So that was the impulse or idea that why not to measure it? Why not to see how exactly it works? And again, that was the moment that I was always also thinking about music therapy as a part of my academic experience. Still in Poland that was the moment that music therapy was not so well recognized as a therapy or as a treatment. So that was also something what makes me think about research to be more confident speaking about music therapy, how it works, how we can use it, how we can apply it with the client. So that was the moment when I applied for a funding, and I got and my research was funded by the National Science Center in Poland. So I start my PhD adventure, I would say, because I've learned a lot through that process, I would say, because probably everyone who did this knew that it's not just doing the research, that's an adventure. That's the way how we develop our research skills, but also our clinical skills. And I've learned a lot, really.
Well, tell us, because I know the outcomes of your research were exciting, and some of them were predictable and others were a surprise. So can you tell us just briefly about what you discovered?
Yes, well, I start what I've done exactly. I was investigated the influence of major role of the combination of all three neurologic music therapy, sensory motor techniques, to improving more or less the gait, parameters, postural stability, and what was the most important for me, the quality of life in the course of Parkinson's disease. I was expecting that we can improve the way how the clients are walking, but I was not expecting that much that we can improve the quality of life that strongly. What we observe, and it was something what was the most important for me, that we could see sort of practical application of that research, and also the transfer from the therapy room to the daily life activities, or daily basis situations when patients are dealing with their own lives, because they could really learn how to walk, how to do activities, and also they could feel much more or much less pain or bodily discomfort. So that was something what I was not really expecting that much. And also something what I am calling like positive side effects of that research, that anytime patients were listening to music, playing the instrument during the activities, they were really focused of what they are doing. So we also could observe positive effect on cognition, and also using the hands, which are the like cortical representation are very close to the face, and patients were using the hands for playing, for doing stuff, and we could also observe improvement of communication, like the muscles were like more relaxed, and patients were able to communicate with the others much clearly. And also like through music we all have like sort of emotional well-being rise up, and it was also in that case that the music is much complex than we expect, and we can really looking for outcome which we said in the research question or in the hypothesis, but then using music therapy or using music for the research we can see much more, and it was in my case that I received much more than I expected from that research.
Wow. It sounds like you had a lot of different outcomes, and certainly more than just gait. So there's a lot of research in neurorehabilitation and music therapy around the world. So I know you're a part of that community of scholars who talk and communicate about this particular area. But how does that sit specifically in Poland? So how does your neurorehabilitation research sit alongside other research in Poland? Is it all quantitative around your area? Are there more creative arts methods?
Well, speaking about neurorehabilitation, we mostly in like using music therapy, we mostly use quantitative research, like randomized controlled trial, but mostly quantitative. Some of my colleagues, they're using music therapies in post stroke rehabilitation for the patient, but they're focusing more on cognitive function or also to emotional coping style, let's say, how patients are dealing with the new situation, let's say, after. So from that research, I know in the neurorehabilitation, there was also one master thesis research focused on executive function post-stroke. So more or less, we all using the same methods, and mostly quantitative methods in the area of medical science, let's say, but there is a strong qualitative orientation also in Poland, and it's according to social science research also, or education research, or music therapy in education. So what I know well, it's qualitative research with adolescents, or case studies, also working with adolescents. Also, some of my colleagues use the mixed methods, for example, working with autism spectrum disorder. What also is quite unique in our country, it's something what we call authorship methods of individual research. So the research focus on like a single case design that's we can explore it in the area of music therapy in education, but also in art therapy research. So those methods are also quite well known and still developed in our country. We have also something what we can call music and medicine, but it's mostly focusing on music and physiology, let's say, what we can observe in the body, how music can influence the body. And something which we are very proud of nowadays, quite recent foundation, which is called Polish Northrop Robbins Foundation, and they're starting community music therapy, which is like beautiful work with clients, with the open music therapy sessions. So they are slowly starting the research, let's say participatory research, to see how we can, through observation, have outcome of music therapy. So in a different parts of Poland, we have different music therapies, and we really feel the need of research in our country. So, and to really establish music therapy as a proper treatment that it can be used in a different population with different groups of clients and individuals. So we are quite aware that that's important, and we are trying hard, and we are, I need to say that we are influenced by the Western's music therapy, and we as you said, being at the Congress together, we are like really sharing ideas, and we are grabbing the best, and we're applying here, and to be able to really work on the proper way, on the proper, with the proper research design, I would say.
Yeah, you certainly are. And the research that I've seen coming out of Poland is extremely strong. You also have, just to finish off with, you also have a fairly large body of music therapists working in Poland. I know, and that you host large conferences, and you're always inviting international guests. So it's exciting to hear that interaction, not just within your colleagues in Europe, but also bringing people out all the time from America and Australia and around the place. So Poland has been very strong in the international scene. So what are your hopes for the future of research in music therapy specifically, or perhaps in Poland, maybe for the last moment?
Well, I'm looking for inspiration for my own research, and definitely it will be something with neuroscience and music therapy for sure. But like in general, I'm really looking for the proper quality of research, because we still in Poland probably need the proper design, and we are getting stronger and stronger. So through the influence from the other researchers, but I'm really looking for the variety in Poland of the music therapies. I'm personally working in neurorehabilitation, but also really supporting other groups of clients and other ways of working. So I would say that that's the beauty of music therapies, that we are same, but we are different, and we can really share what we are discovering, and we always can learn one from another. So that's
Oh, no, that's beautiful. We are the same but different. Exactly. So what this series of music therapy research videos is really trying to highlight is that there is quality research going on around the world. Sometimes PhDs are the leading edge of where research is being done. In other places, there are whole bodies, teams of music therapists working in universities with postdocs and really advanced research, but that across the world, there's a lot of similarities that are more about, if you're working in neurorehabilitation, then you might have an evidence-based orientation with quantitative methods. If you're working in social justice, then obviously participatory methods like the ones you talked about in relation to Northrop Robbins, perhaps more suitable. And then people change over as well. But that diversity and that richness, the same but different, is really exciting. Well, thank you for your contribution to music therapy research around the world. Your work is stunning. And we look forward to hearing more from you in publications and at conferences as time goes on.